If you're trying to conceive and feeling overwhelmed with fertility advice, then this podcast is for you. Welcome to Don't Tell Me to Relax, your fertility podcast and antidote to unhelpful fertility information. I'm Hannah, a fertility acupuncturist, teacher and campaigner for better fertility education. This podcast aims to empower and inform you about your menstrual cycle and fertility. It's basically all that information you didn't get in sex ed at school, with the aim of improving your understanding of your reproductive health and optimizing your fertility. Hello everybody and welcome to this week's episode. I'm really excited because I've got Dr. Helen O'Neill with me today and we are going to be talking about at-home testing because she runs a company called Hertility and they do a lot of testing at home for hormones and fertility information. And I've been in practice as an acupuncturist for 11 years now. And when I first started in practice, we used to spend a lot of time trying to get people to go back to their GP because people weren't getting the results. They weren't getting the tests that we knew that they needed in clinic. And I have to say, the last sort of 3 years has revolutionized what we can do in clinic because we've just taken away that stress of trying to get the right test done, trying to get test results by using online companies like yourself. So I'm so pleased that you're here to speak to us because I know it's a huge part of the work and the interest of people that listen to this podcast. So Helen, would you like to tell us all about yourself and your company and how you came to this place?
Absolutely, and thanks so much for having me. One of my biggest goals is to catch people early in their journey because it is a journey of discovery and there's so much information out there that can be really misleading, quite confusing and very often daunting because you just want to get it right. So I am a molecular geneticist by background. I have always had a really keen interest in genetics because for an interesting reason, I am an identical twin. So I think from a really early age, I had an appreciation and understanding of genetics because I had somebody that looked the exact same as me, even though I felt very different to them. So I studied molecular genetics at university, and then I went on to do a Masters of Science in Prenatal Genetics and Fetal Medicine at University College London, which I absolutely loved. It gave me an insight into the world of IVF, embryology, and kind of all of the different things that are involved in understanding those key determinants of life, a sperm and an egg, and when they meet and form an embryo. And then I went on to do a PhD in stem cell genetics and developmental biology, looking really at the formation of an ovary. And after that PhD, I became a tenured lecturer at UCL, where I still lecture. I've been there for 9 years. I lecture master's students and medical students about reproduction, assisted conception, fertility, infertility, female reproductive anatomy, genetics. And so it's really been my whole world, essentially for the last 16 years and more, in fact, is really better understanding everything there is about human reproduction. And so you can imagine when I got to the stage of really wanting to understand where I was in my journey, I think it's quite a depressing and daunting thing to lecture about the sheer prevalence of infertility and not have any idea about your own fertility. Really none. And wondering, how is it that everywhere I go, the conversations that I have quite naturally lead to this burning question that we all have, which is, am I fertile? Can I have a baby? And you might, so many people say that isn't something that women think about anymore. That is not true. We have an internal dialogue that is constantly asking these questions. You know, when you look at even young children, we give them dolls to play with. You know, that maternal kind of desire is built into us, whether, societally that it's put into us or naturally. And so it is a strange irony to not really have any answers as to your own fertility when you lecture about fertility and infertility.
Yeah.
And so that's really what led me to start Hertility, to really translate some of the information and the research that we have in the lab and to bring it to the everyday woman, and to do so in a way that is approachable, warm, understanding, coming from a place of somebody who I'm building this for myself, for my friends, for my sister, for my cousins, for all of the conversations that I have every time I'm out. These are the people for whom we're building answers for. And so taking into account the fact that the language needs to be clear explained, understandable, and just on a human level.
Yeah. And it's interesting because I would say the biggest reflection we hear in clinic is that, because often when people come to our clinics, they're a bit further down the line and they're feeling a bit desperate. They're feeling like, I've got nowhere else to go. What can I do? I feel so unsupported. And so they sort of come as a last ditched attempt to kind of get some support and information. And repeatedly people say that they wish they'd known more about their fertility and they wish they'd known more sooner.
Yeah.
And it is so common that's, why I started the podcast. It's why I do lots of work around fertility awareness, because, people who come to our clinic are often late 30s, early 40s, and they're saying, why didn't I know about this in my late 20s? Because time obviously is such a big factor. And so I think companies like yours and just this whole sort of revolution in understanding women's health is a really important part of feeding into that, these increased rates of infertility that we've got.
Yes, absolutely.
It can only help.
Absolutely. I mean, we are all we're such a generation of connected individuals, right? We're connected within a second to however many friends we want. We can reach out, we can find information in the palm of our hands, and yet we are so disconnected with our own bodies.
Yeah.
How many people come to us and they don't even have an understanding of their menstrual cycle patterns, when ovulation is. These are really core signals that our body gives us to let us know whether we're fertile or not. And we've become so disconnected with those signals that our bodies give us. And that's for a number of reasons. One, we're not educated. But two, from such a young age, we actually, that plug is pulled out from those notifications when so many women are put on hormonal contraception. And so we essentially mute the signals and notifications that our body would naturally give us to let us know whether something's wrong, whether there's a irregularity. We've just tuned out completely from that normal input into understanding our bodies and really recognizing when something goes wrong.
Yeah, completely. And so tell us, how does Hertility work? Like what do people do? What's the process?
So the process, I'll describe the process from two different journeys. The first is the patient or the person, so that the user journey that person will undergo. And then the second is the back end and what we've created and what makes it so powerful. So the user journey is really simple. They go to our website. They complete a health assessment online where they answer a series of questions relating to their symptoms, menstrual patterns, their lifestyle factors. And from there, they will get a tailored test that comes to their house. And it's a simple finger prick blood test that they will fill up a vial. Then they post that off. So the free post envelope, they post it off. Our lab will measure the analytes within the blood, and then we get the results, and we send them to you within 8 days. And so you're able to view online. We've really made that online experience quite akin to a virtual clinic. So the clinic doors open as you press the button, and you'll be able to walk through your results. There's a written letter from our gynecologist explaining, our team of gynecologists explaining, what your results mean in the context of the health assessment answers that you've given us and the blood results. And so for every hormone that we've tested, we will explain, what is this hormone? Why did we test it? What it means for you? And then you get an executive summary, which is essentially taking into account all of the different interplay between your lifestyle factors and how they could impact your hormone results and vice versa. And then we spent an additional 2 years building what's called the actionable insights, which is to tell you what are the things that you can do to improve your hormones by way of subtle changes within your diet or lifestyle that could result in any one of those hormones to be either elevated or deficient. So it's really easy, end to end. You don't need to leave your house to get a better idea of your fertility and overall reproductive health. From the back end, why it's so important to explain this is that we don't just test your blood results. We don't just test AMH. We don't just give an indication of a blood result. We're not giving you something that says your AMH is 15 picomoles per milliliter out of a reference range of 8 to 1,000. We're not doing that type of, here's a blood test answer. We want to give a blood test result. We want to give you actual answers. So the health assessment, though from the user's perspective is super easy and educational. So for every question we ask, we really tell you why we're asking that question. We say, for example, have you ever had a sexually transmitted infection? 1 in 4 have, so there's no shame there, but some can reduce your fertility, so it's better to know. And so we're really encouraging and supporting a reason why we've asked certain questions, and we're also educating at the same time. So, for some people, they have no idea the things that they are doing could impact their fertility. So we're really trying to say, listen, here's a reason why we're asking this, because did you know that this can impact your fertility? So it's kind of a twofold way of us getting information that we need to make a diagnosis potentially, but also them understanding along that journey why. So we have internally embedded algorithms within that health assessment where we took all of the international diagnostic criteria and guidelines for now 18 of the most common gynecological pathologies that lead to reduced fertility, and we've embedded them within that. And so what we're really doing is creating a very powerful medical calculator. And to me, it makes perfect sense. Intuitively, you would say, when we look for answers about complex mathematics, we use a calculator or an accountant, right? We don't rely on calling out numbers to an individual and hoping they come up with an equation or a solution. And that's kind of the expectation that we have currently on healthcare providers. We sit and we give them a snapshot of our health, depending on what they've asked us, whether limited or not, and expect them to come up with a diagnosis in an on average 9-minute appointment with a GP. And so this gives us the opportunity within that 5 minutes to capture as much information as possible that could lend to a potential diagnosis. Now, bearing in mind the sheer prevalence of reproductive pathologies, it was really important for us to include information or symptoms that could lead to a diagnosis within that health assessment. So we've worked, I can't tell you how hard we worked on this. I'm very fortunate in that, because I'm a lecturer in reproductive and molecular genetics. Most of my research team are my former students who were creme de la creme and really cared about this. So we have really worked hard to ensure that we build in all of that information into the health assessment, so that we're not just testing you for things that are inappropriate or won't matter or won't be informative. We will test you only the things that will yield proper clinical results that could give you the next steps. So that's why it's from the user's perspective, easy health assessment. From the back end perspective, we have embedded algorithms that really help us to calculate your reproductive risk of any one of 18 different pathologies. And that's anything ranging from, hypo or hyperthyroidism to PCOS to, much more structural, where we'd recommend a scan. So in about 47% of cases, we will say you have a clinical reason to need that warrants you getting further investigation through an ultrasound scan. And so that was, again, part of the next steps for us. Yes, we created this at-home test that could be diagnostic and give you informed results about your fertility and overall reproductive health. But we wanted to be able to continue that journey of care, so that should you, once you get your results, should you require a scan, we have a full clinical services service available, which enables you to either book a teleconsult with one of our consultant gynecologists, who we have experts in PCOS, endometriosis, POI, fertility, or you can book a quick fertility advisor call, which is basically just kind of to reassure you as to what the next steps are and what you could do. A lot of people find this quite reassuring, actually, to book in a quick call with a fertility advisor, which is one of our fertility nurses. Or you can book a scan, an ultrasound scan, or you can book nutritional consultations. So really, we have the full suite of services available to you before embarking on a journey. But should you wish, or if you've been trying for too long, and this really gives you the answer to say, actually, do you know what, the results are in, I need help in my fertility journey, then we have we refer to highly rated clinics on the HFEA. So we've kind of taken that guesswork and confusion away from the person. We've said, look, we've done our research, we know who's good and who we're happy to refer to for your fertility journey, should you wish to embark on egg freezing or IVF.
And can you also use the results? So say, for example, something comes up, maybe you can't afford the next step of sort of private medicine, can you use those results to sort of plug yourself back into the NHS? So you can
Yes.
say, look, this has been flagged. You take it to your GP. I would like a referral to my fertility clinic, gynecological clinic. You can do that.
Yes, absolutely. So on your report, which is a beautiful digital report, there is a section that you can download the lab results. So it's basically a raw lab result, which is the currency that clinicians deal with. So you can bring that lab report to your GP and go and get any other. And we are so, like, even throughout the report, we encourage somebody to go to their GP to get it should they wish. That's a difficult balance for us because we want to be there as a trusted provider of information for individuals. We're not here to upsell in other services. We're here to encourage you to go through. But there are some people for whom, if you even mention them going back to their GP, they're quite frustrated because they've gone through the ringer and gone through multiple appointments. And that's unfortunately the reality, is that it takes on average 10 appointments to get a clinical diagnosis. And so that's why we're really proud to be able to bring this to somebody within 8 days.
Yeah. And you know what? Funnily enough, I did an online consultation myself yesterday and recommended you and the test because I had somebody who has been trying to get a diagnosis for 7 years and, has been to the GP. And this is not deep GP bashing in any way, shape or form, because we know it's not the system. And not,
we also rely, in order to make a clinical diagnosis for many gynecological pathologies, we rely on a very complex calculus of information surrounding your lifestyle, any medications, any previous infection, your menstrual patterns, your symptoms. So many of those symptoms are very insidious. The pelvic pain, of course you're going to assume that it's a bad period. We can't differentiate, while eyeballing somebody, in the absence of thorough information, what is wrong with them, and in the absence of having a thorough blood investigation as well.
Yeah, I mean, she had been 7 years, and also because of COVID, it just she was like sort of in the system. COVID stopped it, trying to get in, and just was feeling so deflated.
Yeah,
that it's sort of given up.
Problem. There are currently 530,000 women on the wait list for the NHS just to see a gynecologist.
Yeah,
and that's because during COVID, all of the non-essential clinics were closed, or all clinics that were considered non-essential were closed. And that was all the gynecology clinics.
Yeah. So if something comes up with one of your reports, obviously then there is availability. And this is what I think is so great about your company, is because lots of other online testing, you get the test results and people are like, now what do I do with it? Like, where do I go? But I think having that kind of ongoing support is amazing.
And also interpretation. Like, there are other testing companies out there and they just give you results, and without interpretation, it's actually really unfair to give somebody something like that where they have to go back to, I always say that there's the other GP, which is your Google practitioner, and you're sat Googling things, hoping for results. And that's a dangerous position to be in.
And so in terms of like scans, because again, I mean, we're really fortunate because I'm based in London, and so we've got great links with scanning places, really reputable scanning places, so we can refer locally. But obviously people get in touch with us from all over the country. So do your scanning places, are they all over are they like nationwide?
They're nationwide, and we have 85 clinics that we refer to.
Wow, that's amazing. That's so good. Okay. And so I presume that information is sort of told to you once you've gone through the process. Should you need a scan, then you're like these.
Yeah. You pick based on your location.
Yeah. Great. That's so good, isn't it?
Yeah. We've really thought of this from the human perspective. Like, we've all been through things where look at us. We're tied to 30-minute segments on our calendars. It's actually very difficult. We just ran a campaign last week, and it was like, do your sister a solid. And we actually said, we would sooner bring our pets to the vet than we would bring ourselves to medical care. Like, we wait until things are really drastic before we actually bring ourselves to for an appointment. And then when you when you go to finally do that and it's obstacle after obstacle, or you're not left with any results, it is demoralizing. You do kind of give up. You just
Yeah.
end up on this odyssey to an extent where actually you just put up with it. And I think removing any of the barriers to entry from our very complicated lives really is what we need. So that's why everything is done from home. You do a health assessment, you do the blood test, you can speak to a practitioner. We're introducing prescriptions as well, so that you could essentially sit at home, do this health assessment, get a test, get a potential diagnosis and results, speak to a practitioner who can prescribe you something, and it will arrive at your house that day or the following day. So just streamlined access to care.
Yeah. So that is a question that we are often asked. We're often asked around prescribing. Lots of people are looking at they want to use progesterone for luteal phase support, or thyroxine, for example, if their thyroid's out, but they're struggling to get that support through their GP. So is that the kind of prescriptions that are available, or is it really dependent on, obviously it's dependent on who comes through the door?
Yes, that's exactly it. That's exactly it. It's dependent. So anything really that you need, we can then prescribe.
Wow. And so that can all be done online through the post. You don't have to leave your house.
No.
That's absolutely revolutionary, isn't it?
Yes, it is. I mean, to be honest, I ordered something on Amazon the other day, and I actually felt quite ashamed that it arrived at my house that night. And I was like, this is so trivial. I did not need this. It was like a peeler or something. And I just thought, how is it that we have infrastructures and logistics that are so well oiled when it comes to buying things that nobody needs, and yet people who desperately need medical help cannot get access to even a human being to speak to, let alone service. So I think we need to recreate. That's our plan, is to, we know that healthcare was never built for women in the first place, and so we really want to recreate the healthcare system built solely for women.
And so I guess Hertility is really for anybody. You might not be ready to conceive yet. You might be just wanting to find out more information about your hormones. I guess it goes across the board, doesn't it, of who it's for?
And I know the name is Hertility, which makes it sound like we are solely fertility. We are much more of a general gynecology tool, and we built it into that because general gynecology matters to your fertility. I would love for every 20-year-old to check in.
Yes.
You're not going to, you would be considered wasting GP time if you were a 20-year-old who was just curious. And yet, when we know that, for example, the incidence of cervical cancer is 1 in 64, and we have this emphasis on getting your smear test, which is so important, I think that same emphasis should be there for every form of reproductive pathology, especially when their incidence is like 1 in 10. In fact, 1 in 3 women will have a reproductive pathology at some point in their lives. So having that annual check-in, to me, should be part of our everyday narrative, no matter what age you are.
We say this all the time about, even if you're not ready to think about conceiving, but let's say, for example, as you mentioned, so many people are put on contraceptions at a very young age because of hormonal issues. And we always say, wouldn't it be amazing if every time you went to get a repeat prescription, you had a check-in and you had a full conversation about, is this a good time to maybe come off, see how your hormones are, maybe do some investigations, see whether things have settled down. Let's try and get to the root cause of your problem, do some testing. But it's just kind of like doled out, repeat. And people come and sit in clinic and they're like, I was on the pill for like 18 years and nobody ever discussed with me that the reason I went on for painful, heavy periods might actually be an indicator that could affect my fertility in 20 years' time. And they're so cross, and rightly bloody so, that has, all those opportunities that there were to have that conversation it was never flagged.
And it's like giving somebody a bandage and just saying, here you go, we won't look at the wound, we'll just put it over it and hope it goes away. And what's hard is that if you are put on a form of contraception to reduce a symptom, like whether it's hormonal acne, whether it's painful periods, heavy periods, there's no day is a good day to decide you want that back in your life. And so this twofold problem where you're a little bit afraid to even take that bandage off, right?
Yeah, absolutely. But I think it's about having that awareness that there are things that you can do, because I guess, the general kind of consensus that has been there for a long time is that if you have problems with your hormones or your periods or, you know, any kind of gynae problems, then these are your options. You've got contraception, you've got painkillers, and that's basically, you know, or surgery or, you know, some major intervention. This whole idea, and this is what we talk about a lot in sort of my clinic, is this whole idea that there are things that you can do yourself in terms of your lifestyle, what you're doing, what you're putting in your body, how much you're resting, how much you're exercising, all of those things can have an impact. Like we have some control over what is happening with our bodies. But it's sort of like that message kind of got a bit missed. And it was like, well, you are somebody who suffers from painful periods. And so this is your option, without looking at that person as a whole, is kind of not serving people. So then people feel concerned about, well, what can I do? These are my only options, which I really don't think is true.
No, and there's actually one of the biggest studies looking at PCOS and anovulation. So we know that a lot of that women with PCOS are, you know, have irregular ovulation, so they find it difficult to get pregnant. But in 70% of cases, regular ovulation resumed through dietary and exercise intervention. Yeah. And yet we overly medicalize things to an extent when actually so much is determined through our lifestyle. Yeah. And what we put into our bodies. Of course, it's the most obvious thing in the world.
It is, but it's weird how it's not been in the conversation ever.
No, it isn't. Yeah, it's not. I think we've become just a completely medicines-driven generation because there's a pill for everything.
Yeah. Yes. So thank you so much. For people to buy the test kit and do the online form, it's all through the website, which obviously I'm going to put in the show notes. Have you got any campaigns or anything coming up? What are your sort of plans going forward?
We are going to be launching essentially because nobody funds women's health and our revenue fuels our research. We have jumpers and t-shirts and wash bags that say, "I'm not overreacting," with a nice ovary on it. And so the proceeds of that will go towards our research. So we really want women to wear these with pride and just say, like, I am part of building a better future for women. So we're launching that next week. So probably by the time this is out, check out our merch.
Oh, amazing.
Wear with pride, support research into women's health. And I think that's what we're hoping to do is, you know, it's a twofold approach. One, let's educate more people. And two, let's not suffer in silence.
Yeah, absolutely. Well, thank you so much for your time. We really, really appreciate it. And I know that everybody listening to this is going to be so excited and so interested in finding out more, because it is literally ticking the boxes of, I imagine, the vast majority of people who listen to this. So thanks so much.
I hope so. It's like 3 appointments in one. So hopefully it's a worthwhile journey to go on.
Thank you so much for your time. And as always, all the details about what we've talked about today are going to be in the show notes. So if you want to find out more information, it's going to be in there. And thanks for listening. If you've enjoyed listening to this and want to find out more, then come and join my free community in Facebook. We have loads of resources. You can catch up on all our previous webinars and be the first to know about forthcoming events. To sign up, just follow the link in the show notes. And if you'd like to work one-to-one with myself or one of the team, then please see our website, hannahpern.com, where you can book in directly or organise a discovery call to find out how we can support your fertility and your reproductive health.